Well, before the break, we explored how some members of the Black community feel about vaccines and, more broadly, Canada's healthcare system. But let's dig a little deeper on this, on understanding the problem and figuring out how to approach it with Dr. Zane Chagla, an infectious diseases specialist with St. Joseph's Healthcare, and Akwatu Kenti, the chair of the City of Toronto's Black Community COVID-19 Response Plan, which was announced today. Akwatu, if I could start with you, can you help me fine-tune my understanding of the problem? Because we shouldn't be tempted to think that there is a singular Black community here that is uniformly hesitant, right?
Yeah, no. We have several communities, and the risks are divided according to income, housing, occupation, and habits, work habits. And they're not equally divided. So it requires some degree of complexity in terms of analysis, but simplicity in terms of delivery.
Right.
Delivering the message, I mean.
And Dr. Chagla, I mean, the pressure points, of course, are different, but so are the stakes depending on who we're talking about, because you can't talk about race without talking about living conditions, without working conditions as well.
Yeah, absolutely. I mean, I think it's very clear from the data that's been distributed to date, minority communities, particularly the Black and the Brown communities, have had significant issues with it. They're overrepresented in case counts. They're overrepresented in deaths from COVID-19. And much of it has to do with some of the other determinants of health in terms of poverty, in terms of instability, in terms of housing, in terms of the need to expose themselves to communities and put themselves out as essential workers to provide for other people that can shelter at home safely. And so many of those things add up to a higher risk for COVID-19 and need to be considered as part of the planning for vaccine plans and other public health measures.
So, Akwatu, how do you even begin to deal with that? Like even just on a human-to-human level, when you encounter skepticism, what do those folks want to hear? What do you tell them?
Well, I encounter skepticism all the time. Friends and family members. I live in the Black community, so what do I tell them all the time? I tell them that vaccines will not give you the disease. That's one of the myths that's going around there, the misinformation. It won't give you COVID. It won't give you HIV. It won't make you infertile. I tell them that although the vaccine was produced expeditiously, it was produced in a methodologically sound fashion, and it actually utilized a lot of previous research work to sort of hasten the process. I mean, instead of doing things sequentially, it was done in parallel. And so the process is sound. They can have confidence in the process. I tell them that the vaccines will not alter their DNA. There won't be any microchips going into their body as a result of the vaccine. Side effects don't include significant mortality risks. There's more mortality risks with COVID. And I also tell them they happen to live in a city, a province where anti-racism is enshrined in law and actually taken to higher levels, that certain things that happened in the past, historical exploitation of people of color, especially Black people and Indigenous people, are less likely to happen now. I don't say they won't happen now. I say they're less likely to happen now.
So, Dr. Chagla, if I could ask you one more question. How best to walk the talk, right? Because we can give the information, but we've got to do more than just persuade with words. We've got to sort of actually show those who are hesitant that the vaccine is safe and also worth getting. So how do you approach that?
Yeah, I mean, I think the work that Mr. Kente is doing and others is essentially that. It's creating champions within the community. It's creating positions of trust, not just in medicine, not just in the news, but actual community leaders, cultural leaders, religious leaders. Make them the champions, as they're often the ones that reach the ones in their communities better than officials. And communicating across all channels, across social media, across traditional media, using WhatsApp. There are just so many pathways here where people get their information, they perceive trust, they clarify their needs, and any plan to make vaccinations move forward needs to include these as part of an equity approach to make sure people get the appropriate vaccine for them.
Okay, we're going to leave it there. Dr. Zane Chagla, Akwatu Kenti, thank you so much, both of you, for joining us tonight. I appreciate your time.
Thank you.
No problem.